Hi everyone, this is an interesting case from the emergency room. We have a CT scan of the abdomen and pelvis performed with oral and intravenous contrast in a male patient presenting with abdominal pain, substernal and epigastric abdominal pain. Now, as we scroll through the abdomen and pelvis, the lower abdomen and pelvis are quite unremarkable, but when we scan back up, an abnormality in the epigastrium just beneath the heart. And this is the first thing that catches one's eye when one is looking at the axial images. So let's keep going and look at other sequences and try and figure out what this is. On the lung windows, we can see that there are air fluid levels within this structure. And when we come to the coronal reformats, we see that this is actually loops of bowel which have herniated through the diaphragm to the chest. And the configuration that they maintain is very closely approximated with the base of the heart. So this is in fact an intrapericardiac transdiaphragmatic hernia, which has also become incarcerated or strangulated. So we can see that the loops are actually obstructed in the hernia. This patient, it turns out, had undergone a particular kind of procedure which is known as a maze procedure, which is performed to treat atrial fibrillation. So it's a type of surgery, and presumably the patient had a pericardiotomy as part of the procedure, and this hernia developed as a consequence. So the interesting thing about this case is the fact that on the axial images you can see loops of bowel conforming, dilated loops of bowel conforming very closely to the shape of the pericardial sac or pericardial cavity, and the reformats are particularly helpful because they show us exactly where the herniated bowel is within the pericardial space beneath the diaphragm. So this is an incarcerated or strangulated transdiaphragmatic intrapericardiac hernia. Very unusual. It's one I had never seen before in my career, so this is the first for me, and I thought I would like to share it with all of you. Thank you.